Okay, so the first prompt is about gun control, and I said gun control is a very divisive and complex topic. However, I believe that the correct course of action would be to implement a nationwide gun ban, but that is unrealistic in America, so I said at least much stricter gun control laws than we currently have. With the current climate of gun violence, including frequent mass shootings in the United States, it's becoming increasingly clear that the problem is far more severe in America than anywhere else, and this is because Americans have very strong feelings about their personal liberties when it comes to the use of firearms. However, guns are the leading cause of homicides in the United States. A woman's risk of being murdered increases 500% if a gun is present during a domestic dispute. Firearms were the second leading cause of death for children, responsible for about 15% of child deaths. And there are a lot of alarming statistics associated with gun use that beg the question as to why, as a society, we put so much value on something that is so destructive. And it seems by arming teachers, increasing security at schools or public settings, and installing metal detectors, we would be addressing every problem except the underlying issue, which is the accessibility of guns. I am of the belief that there will always be unstable individuals and people who should not own guns who are capable of committing heinous acts like mass shootings. But as a society, we can choose not to give them the tools to carry out these heinous acts. And one of the main examples that shows the benefits of addressing the issue of guns rather than all the other issues is the 1996 gun massacre in Australia that left 35 people dead. It was one of their only mass shootings. Following the incident, Australia immediately implemented a nationwide gun ban that received overwhelming support from citizens, and they saw a significant decrease in firearm-related homicides and suicides. And in the next 26 years, there was only one mass shooting in the country. When compared to the sheer amount of mass shootings that we see here in America, there is clearly a direct correlation to this, like, our society's positive attitude towards guns. And it ultimately feels as though we have exhausted all of our options trying to ban or reform everything except the guns themselves. And I think we're at a point now where there needs to be reform in this area, as nothing has worked, and we have seen positive results from doing this in other countries. The next prompt is about universal healthcare. I said that I believe that healthcare is a basic human right and that should be extended to the whole of America. The government has already successfully provided universal healthcare to close to 50% of Americans who struggle with disabilities, low income, and other factors that play a role in their ability to maintain healthcare for themselves. But that still leaves half of the nation without their own, without paid for medical coverage. Some studies have found that universal healthcare would actually lower costs and potentially prevent medical bankruptcy. For example, a June 2022 study found that the United States could have saved $105.6 billion in COVID-19 hospitalization costs with single-player universal healthcare during the pandemic. The potential savings is on top of the estimated $438 billion the researchers estimated could have been saved annually with universal healthcare in a non-pandemic year. According to the National Bankruptcy Forum, medical debt is the number one reason why people file for bankruptcy in the United States, and in 2017, about 33% of all Americans with medical bills reported that they were unable to pay for basic necessities like food, heat, or housing due to the costs of these medical bills. I think this highlights a real failure in our current system, that citizens are forced to make the decision between basic necessities and necessary medical care, when it should be a basic human right, and there doesn't need to be a dollar amount placed on that. Universal healthcare would be of great benefit to low-income households, and would also greatly improve nationwide health outcomes. It's linked to longer life expectancy, lower child mortality rates, lower smoking cessation rates, and lower mental health crises rates. Ultimately, though, it is easier said than done, universal healthcare has been successful in other nations and is a basic human right that citizens should not have to worry about. And then finally, the topic was unsafe consumption sites, and I said the sad reality of addiction is that users will always find a way to use. What we can do as a society is facilitate the safest conditions in order to reduce the risks associated with drug use. Many argue that safe consumption sites will enable drug use, but the reality of the situation is that as long as drugs are accessible, people will always be enabled to use them, and so we need to start thinking of other solutions. There are also many misconceptions about what consumption sites like actually do and how they work. And I think it's interesting that one of the main risks of drug use that they help diminish is HIV transmission from injectable drugs. This is a really big risk associated with drugs that can be shot up, and decreasing the risk of disease not only helps users but the communities that they belong to. And consumption sites were found to be independently responsible for a significant decrease in syringe sharing. Aside from reducing overdoses, infection, and syringe sharing, consumption sites also have a really beneficial effect on harm reduction associated with drug use for communities. A study focusing on an urban district in Australia found that public areas with high rates of drug use carry risks for both the community at large and individual drug users, such as risks related to public injection, publicly discarded syringes, like injection-related litter, and drug-related crime rates. And ultimately, I believe that safe consumption sites are a net positive for a society that has really been ravaged by drug use and the epidemic that is, and that if there are ways to help reduce the risks associated with drug use, we should be funding and implementing these nationwide. And that's it. Thank you.